The global number of coronavirus cases has hit a mark experts say proves the pandemic is not slowing down. According to Johns Hopkins University, more than 40 million people tested positive for COVID-19 since the beginning of the pandemic. But that number could actually be higher because many people are asymptomatic and have not been tested. Also, researchers warn some governments are not revealing their true number of cases. The U.S. remains at the top with the highest number of cases of any country, with more than 8.1 million confirmed infections. America also leads the world in number of virus-related deaths, with more than 219,000. Hospitalizations are up in at least 30 states. CBS News lead national correspondent David Begnaud shows us an ICU at one hospital that has reached 104% capacity.
Coronavirus is pushing Utah's hospitals to the brink. The ICU at the University of Utah Hospital in Salt Lake City was at 104% capacity last Friday, and that forced patients into surge beds.
This is as serious as it gets.
Dr. Russell Vinnick is Chief Medical Operations Officer at University of Utah Healthcare. He says with cases still rising and no noticeable improvement in people's behavior, he believes the worst is still ahead.
We cannot manage a long surge. And with the weather getting worse, with Halloween, Thanksgiving coming on, people are more likely to have indoor social gatherings. We absolutely have to have the public change their practice and make some sacrifices.
Public health experts continue to urge Americans to stick to the basics of virus prevention, like social distancing and wearing masks. But the newest member of the White House Coronavirus Task Force, Dr. Scott Atlas, who is not an expert in infectious diseases, posted a tweet on Saturday claiming that masks do not work. It was removed by Twitter for violating the site's policies against misinformation. Meanwhile, President Trump continues to call the efficacy of masks into question, even pointing to Dr. Anthony Fauci and his guidance from the early days of the pandemic as reason the president says we should all be skeptical.
Then he said, do not wear a mask. So if we don't wear a mask, then they say, oh, wear a mask.
In a 60 Minutes interview with CBS News Chief Medical Correspondent Dr. John LaPook, Dr. Fauci took the time to explain why his stance on masks changed.
Let's see if we could put this to rest once and for all. It became clear that cloth coverings, things like this here, and not necessarily a surgical mask or an N95, cloth coverings work. So now there's no longer a shortage of masks. Number two, meta-analysis studies show that, contrary to what we thought, masks really do work in preventing infection.
No doubt.
So no doubt.
You know, here in New York State where we are, they continue to be really strict about keeping an eye on large gatherings. There was supposed to be a wedding in Brooklyn, probably still will be, where the guest list, we're told, could have reportedly been as high as 10,000 people. But the state got involved. The governor sent his representatives who had an order in their hand saying you are not allowed to have more than 50 people. David Begnaud, CBS News, Manhattan.
I want to bring in emergency physician at Lenox Hill Hospital here in New York City, Dr. Robert Glatter. Robert Glatter, thank you so much for joining us. Doctor, we are seeing a spike here in New York City in new coronavirus cases. Is this a sign to you that we will be entering a second wave of infections?
Yes, I'm very concerned. In fact, we're talking right now really about a third peak, the last one being in early July. And, you know, the indicators are there. I mean, you know, the fact that people aren't still adhering to, you know, public health measures that are tried and true, wearing a mask, physical distancing, you know, these are key things which we know reduce transmission. In fact, recent studies show that just wearing a mask reduces transmission from person to person by up to 90%. And that's very significant. That's what we're talking about viral particles. We're talking about aerosols that don't have the opportunity to reach someone else close by.
So are you experiencing a surge in new cases and hospitalizations at your hospital in Manhattan?
We have not yet, but there have been trickles of numbers of patients coming in with symptoms, and some have tested positive, but I wouldn't characterize this as a surge at this point in time.
Okay, that's at least good news. Now, the surge in cases across the country has prompted some experts to believe or to worry that flu viruses and the virus that causes COVID-19 could both spread at the same time this fall and winter. Do you believe that hospitals around the U.S. are now better prepared with a plan on how to handle both the coronavirus and the flu should they both hit in tandem?
I think the reality is that the rural areas right now are really facing a dilemma. I think that capacity right now is an issue, and that certainly, meeting that capacity, not just having beds, but having available physicians and nurses and respiratory therapists is a real issue. And I think it's going to be a challenge. As you can see out in the Midwest, especially after the Sturgis motorcycle rally, which likely seeded areas including North Dakota, we are having a real issue, a real challenge in order to take care of patients. And so a field hospital might likely be one of the best ways to handle this. As far as the Northeast goes, I think that we're set up. We know how to handle the surge of patients. We know what to do. We have the measures in place. And if we need to have additional facilities available to meet the surge, we'll do it.
Right, so we're better prepared this time around. So, Doctor, in terms of best practices, I mean, I know we talk about this ad nauseum, but I suppose it can never be repeated enough. Is wearing a mask and getting a flu shot still the best way to tackle these viruses right now? What should people be careful of?
It's the basic things as you're alluding to, exactly. It's washing your hands, it's wearing a mask, it's staying your distance. These things are science-based, they're evidence-based, they're tried and true, and we need everyone to practice them. It's imperative that public messaging get out to everyone on a federal level, that we need to have such measures in place and that everyone needs to follow these. We have to get through this winter. We're anticipating the next 6 to 12 weeks of being a very dangerous time, as Dr. Fauci alludes to, and I think he's right on target. We need to really bear down. This is the time.
All right, and everybody has to work together. Like you said, we've got to work in tandem as a country, and everyone has to take these precautions in order for everything to work. All right, well, Dr. Robert Glatter, thank you so much for joining us. We really appreciate it.
My pleasure. Thank you.